Hello, everyone, and welcome to our second webinar of the 2024 webinar series. I'm Adam Wilton. I'm the health promoter with Community Care Peterborough, and I'm here to talk to you today about heart health and you because February is Heart Month. So we thought, why not stay on the topic with Valentine's Day tomorrow and talk about all the things we can do to keep our hearts healthy, all the things that we do that might be inadvertently negatively impacting our heart's health outcomes. And without further ado, we'll get right into it. If there's any questions at any point, please feel free to throw them in the chat and I'll happily answer them then, but I'll also leave some time for questions at the end as well. But on that note, we'll get started. So what does heart disease look like? I'm going to mention heart disease a lot today, and I thought I'd put in this graphic for you guys so everyone can see that heart disease a lot of the time refers to a buildup of plaque or cholesterol around the walls of the arteries or veins within our body. So there's four main types of heart disease. There is coronary heart disease. This is just heart disease that's regarding the veins and arteries that actually feed blood to the heart, keep it pumping. There is stroke, which is referring to heart disease when there's a blockage specific from, so one of these pieces of plaque or cholesterol will break off and cause a blockage of blood to the brain so that no blood is getting to the brain. There is peripheral arterial disease, which is when a piece of this plaque will break off in somewhere like our arms, our hands, fingers, legs, toes, feet, and that it'll affect them somehow by not being able to get blood there. Or there is aortic disease. The aorta is the largest, I believe it's a vein in the body, and just sometimes we can have a lot of plaque buildup there, and get a little bit of narrowing or even a full-on stoppage in the aorta too. So today we're going to cover quite a couple of subjects regarding heart health, and the things that mainly impact our heart health outcomes. So things like eating oily and fatty foods, stress, smoking and smoke exposure, so like secondhand smoke, and then finally sedentary lifestyles. Oh, and excessive drug and alcohol consumption. So, as we all know, there are tons of healthy foods out there, but then there are also their counterparts are unhealthy foods. So, when it comes to food, there are three main sources of energy that all foods contain. There are carbohydrates, these are like our sugars. There are breads, which are just complex carbohydrates, which means there are a bunch of sugars stacked on top of each other. Carbohydrates are very quick energy. Our body takes them in and uses it almost immediately. When that energy isn't immediately used, a lot of the time it's turned into this plaque and cholesterol that lines our veins that I mentioned before that helps cause cardiovascular disease. So there are carbohydrates, our quick source of energy. There are proteins, which is our longer source of energy. This is more like a 24-hour period source of energy. Proteins also very important because it's the building block for new muscle. When we exercise, we're always building new muscle, and that's what protein goes towards. So it's both our longer term energy source and our main energy source, as well as our building block for our muscles. And then finally, there's fats. As some of you may or may not know, there are healthy and there are unhealthy fats. What this means is there are certain fats that are easier for the body to digest, easier to turn into storage, which is the fat we see on our body. And then there are some that are harder for our body to store, and that turns into the cholesterol, into the plaque that lines our arteries and veins that we talked about. So foods like black beans, sweet potatoes, walnuts, and almonds, these contain a lot of both protein and fats in them, but the healthy fats. So these are great foods for long-term energy. They're going to keep us going throughout the day, and it's not too hard for our body to digest these foods to get the energy where it needs to be. Without a lot of byproduct. There's also a lot of vitamins and minerals in these foods. So it's making everything a little easier for our body to digest, but just by giving it the proper nutrients that it needs. There's also things like oranges, cherries, and blueberries on here, oatmeal, yield, barley, and flaxseed, which is our carbohydrates, our sugars, and our breads that we talked about. So these, again, shorter term sugars. We all need some sugar to function, but by having these foods in our system, we also again get all those nice vitamins and minerals, and it's also a healthier sugar that's easier for our body to use. In contrast, there's things like red meats. While these are a great source of protein, they often do have fat, and they aren't the easiest fat for our body to digest. So this will be the fat that is turning into the plaque lining our arteries and veins. There's also things like sugar-heavy foods and drinks, and white rice, bread, and pastas. White rice, white bread, that's not its natural color. That's not a naturally occurring color. So a lot of the time, extra sugars are used to sort of bleach these breads, these pastas, these rices, just to kind of give them that natural white look. So this is just a lot of excess refined sugar that's going into the body. It's hard for the body to use this. It's hard for the body to break this down. So it's a lot of the time will turn into that plaque that lines the body if it's not properly used in time. Now, a little sugar and a little extra fat here and there isn't the worst thing on earth as long as, we're eating it within moderation, we're keeping a balanced diet. But then there's things like fried foods, which are just pretty much soaked in the unhealthy fats. So these will have really high levels of cholesterol in them, which will again line our arteries and veins. Not great, makes it a little more difficult for the heart to pump the blood, but we'll get into that in just another moment. And then there's things like alcohol, which we ingest, which are also harder on the system in different ways, but we'll talk about that in a moment. So we want to be mindful of what we're eating, because the better the nutrients, the better the energy source that we're giving our body, the easier it is for our heart to get that energy to stay working, and the easier it is for our muscles and organs to intake those vitamins and minerals and stay properly functioning. So stress is another thing that majorly affects heart health. So stress can both directly and indirectly affect the heart negatively. So directly, stress affects the heart through the increasing of blood pressure. If our blood pressure is higher, we're more likely to have one of those breakages on the wall that I talked about, where a piece of plaque breaks off and causes a blockage in an artery or vein. So having a lower blood pressure is a little better in regards to avoiding negative health outcomes if you're at risk for cardiovascular disease or heart disease. Stress can also affect other areas of our lives that do have an impact on our health, our heart health. Things like our sleeping patterns. When we're not tired enough, our body doesn't have that energy. Our muscles, our organs have to work just a little bit harder to keep everything up and running properly. And as well with our sleep can also negatively impact other areas, as this is all interconnected. So when we aren't sleeping properly, we don't have the energy. We might not have the energy to go out and exercise is the number one best thing that you can do for your heart to keep it healthy. So we want to keep that heart nice and healthy. We want to stay rested. We want to stay exercising, but we'll talk about that again in a couple slides here. And then finally, when we're tired, we're exhausted, we're stressed out, we're not making the best diet choices all the time. It's a lot easier to say, go out and pick up a couple burgers from McDonald's rather than stay at home and make a healthier meal. So we just don't have as much motivation. We're not as willing to do these extra steps when we're tired, we're stressed out. So just being mindful of how outside factors, not just how you're eating, can affect your heart is always very important. So how can our daily physical activity affect our health? So just like our biceps and triceps, our heart is a muscle and it needs to be worked. So what happens when we don't work our hearts? We have that plaque and cholesterol buildup that I've mentioned a number of times now. We're at a greater risk for heart disease and cardiovascular disease. But luckily for us, it's pretty easy to stay active and it doesn't take a lot through our day. The Canadian government recommends about 20 to 30 minutes of exercise daily in order to keep up our heart health. So this is exercise, typically cardio exercise or aerobic exercise is the best. What I mean by aerobic exercise is exercise where we're up, the whole body's moving, Maybe we have to catch our breath a little bit. We're sweating a little bit more. We can really feel our heart rate elevating. That's what we want. Things like going for a walk or a little bit of a jog, a bike ride, whether it's a traditional bike or a stationary bike. I personally love to go on the stair climber and use a rowing machine. These are all excellent ways that we can get our cardio exercise in. And when we get our heart kicked up and pumping a little bit more, it just gets that little bit stronger, uses the protein to strengthen itself a little more. So that's what we need to really keep on top of our heart health. If you are looking to start exercising more and more, if you're someone, you can always check with your physician before starting a new program just to make sure that this is something that is going to be safe for you. If you're looking for something a little more intense, that is, if you're looking for something a little laid back, you can always start off with something easy like a small walk and work your way up. But do check with your physician just to make sure that if you are worried that everything's going to be okay. So next we have unhealthy habits that negatively affect our hearts. So we mentioned this one earlier. Smoking is a big one that negatively affects our hearts. Smoking increases the formation of plaque within our veins and arteries, so it raises our blood pressure a little bit. We're not getting the oxygen to our blood, which subsequently can't go to the muscles, so our heart has to pump a little bit more blood just to be able to get the oxygen where it needs to be. Also, cigarettes contain chemicals that cause blood to thicken, which means the heart has to work even harder on top of its already increased workload just to get the oxygen through the blood and where it needs to be. So this is for smoking and secondhand smoke and things like when we had all those forest fires last summer. So being mindful of just kind of like air quality and things like that you're intaking is always important. Drug consumption also negatively impacts our hearts. Drug consumption can lead to abnormal heart rates and higher stress on the heart. And then also injecting drugs can lead to collapsed veins and bacterial infections in the heart. Collapsed veins obviously negatively impact the heart health because you aren't able to get blood pumping through your veins. The heart is just working all that much harder. So it's just a lot more stress on the heart that this muscle doesn't really need. Finally, there is alcohol consumption. Excessive alcohol consumption has been linked to things like higher blood pressure, a risk of heart failure, a higher risk of cardiovascular disease. So all around, excessive alcohol consumption is not great for the heart. It should be avoided. Yeah. So the next question is, what can we at Community Care do for you? Well, there's a number of options here, luckily. So first and foremost, we have our Meals on Wheels program. I just want to say out the gate that you'll have to order this if you're interested in this. It's not a day of kind of thing. You have to go think ahead of time and call ahead and plan it. But these are nutritious, affordable meals that get delivered right to your door. They come fresh or frozen. They're super great. And then sometimes if if you're having a little difficulty getting out there, I know in the winter it can sometimes be a little difficult to leave the house. This is a great alternative as opposed to getting that unhealthy fast food. There is also grocery deliveries. Which again, it's a lot better to have those groceries delivered to your house, make your own healthy meal than be going out to, I already said McDonald's, but we'll say Wendy's this time, going out to Wendy's a couple times a week and getting those quick meals. It's a lot better to have those groceries in place, do that little bit of meal prep, and then you're eating a much better meal that's going to fill you up more, give you the energy for a lot longer. Next, we've got our Diners Club. So again, this is relating to eating. You can go out, you pay a small fee, you have a nice social gathering, get to meet some new people, you have a good healthy meal. And then a lot of the time we have some form of entertainment at these things, which quite often is some form of health and wellness sort of practice. So you can learn maybe some exercises to do at home just while you're sitting in the chair, or you can learn some other health tips, things like this. So our Diners Club is great for stretching both those social muscles and your actual muscles, and you get a nice meal out of it too, a nice healthy meal. Finally, we have transportation services. These ones can take you to things like social or recreational activities, medical appointments, just to make sure that you are in tip-top shape, you're staying up to date on everything. But then they can also take you to other things like community service events or in social events and things like that. And it's safe, reliable transportation that you can sign up for. And then finally, we have some other services. These are just things, they don't have so much to do with the heart, but I thought they were definitely worth mentioning. We have our home help program in which people can come in and they'll give you help with some chores around the house that maybe you have a little difficulty with. Maybe you want to clear an area so you can do some at-home workouts and join our online exercise and falls prevention classes. That's what it's perfect for. We've got our friendly visiting program in which someone will either call you and it can just be a quick conversation like, hi, just checking to see if you're okay. And then that can be it. Or you can stay on the phone, chat with them, or they can come to you and maybe you can do stuff like go for a walk together, play some games together, do something like that. And then finally, the one that I'm a little biased, but I think is best for your heart is the exercise and falls prevention program available through Community Care. As I mentioned before, all exercise is good for the heart, but especially cardio. And we've got some classes that are especially geared towards cardio. But if you are just starting out, we do have classes available for all different skill levels, all different difficulty levels. So if you're just starting your exercise journey, or you're someone who's exercised your entire life, there's something for everyone there. We have things like yoga classes, seated exercise. We have some weights classes, some cardio classes, some Zumba dance classes. So really, there's a whole variety. You can just kind of check it out. They're free to attend. You see what seems like the best fit for you. And then otherwise, yeah, it's free to attend. So it's perfect. And I think it's one of the best things that you can do for your heart health. All right, and that looks like the end of our slideshow here. So if there are any questions, comments, concerns, feedback you'd like to give, please feel free to share it with me. And once again, I've been Adam Wilton. I'm the health promoter with Community Care Peterborough. And take care, everyone. Enjoy your afternoon.